Order. Question 6. Jim Eadie.
Thank you, Presiding Officer. To ask the First Minister what progress has been made in reducing cancer mortality rates.
First Minister.
We welcome the figures released by Cancer Research UK on Monday, the 18th of August, showing that mortality rates from the 4 main cancers in Scotland have reduced by around 25% in the last 20 years. We are working with Cancer Research UK in a number of areas, and we endorse their new strategy aimed at pushing cancer survival to 3 and 4 within the next 20 years. In recent years, we have been investing to improve Scotland's cancer treatment infrastructure, including £22 million for the new Beatson Centre, now being built at Monklands Hospital, to help meet the rising demand for radiotherapy treatment over the next 10 years.
Jim Eadie.
I thank the First Minister for that answer. While improved specialist care, better treatments and fewer people smoking have all contributed to the fall in the death rates from the top 4 cancer killers, does the First Minister agree that the health inequality gap between the lowest and highest deprivation groups is still far too high for too many cancers, including lung, cervix and stomach cancer, and that programmes that help detect cancer at the earliest stage are absolutely vital to ensuring that everyone in Scotland receives the life-saving treatment they need, which only a publicly funded and clinically driven health service can provide?
First Minister.
Well, yes, I do, and that's why the Government have targeted £30 million investment into early cancer detection through the Detect Cancer Early programme, and invested a further £12 million to modernise the Scottish breast screening programme. In addition to screening, the Detect Cancer Early programme focuses on addressing fears about cancer, on recognising signs and symptoms of cancer, encouraging people to get checked if they are worried, and we know that diagnosis and treatment at the earliest stage helps to improve survival rates. This will ensure that every patient, regardless of where they live, receives timely treatment and follow-up. Jim Eadie mentions the importance of a public health service. I hope that everyone in this chamber understands the importance of protecting and preserving our national health service in Scotland. It is absolutely vital. We believe that can be done through Scottish independence. If there is an alternative route to do it, then it better get spelled out. But the Labour Party members should remember what Ian Davidson's words at this First Minister's questions. The SNP have become what the Labour Party should have become.
That ends First Minister's questions. We now move to members' business.